So usually what you can either have some of this spray. Most of the time you're not going to have the spray. Usually I use the spray just to allow the tape to be to adhere to the skin a little bit better. And we'll tape you up for tonight too, okay? So the first thing you'll do is you always want to keep your foot as dorsiflex as possible, okay? A lot of times what will happen is, like, if you're taping her or someone else is taping you, or if you're taping yourself, what will happen is the foot tends to like to come down, and but you want to always try to emphasize and be aware that you want to keep it up as much as possible, okay? Because that allows the tape job to be more effective, okay? So the first thing you'll do is, like we talked about yesterday, is you'll do a strap here, and you'll do a strap on the foot. All right. The strap here allows the stirrup to be anchored, and so with the lateral ankle or an inversion sprain, when you're coming back from an inversion sprain, what we want to do is we want to allow the tape job to keep the foot in this position as much as possible, not in this position, because then obviously that's how you rolled it, right? So we'll keep it up in this position, so when you do the tape job, whoever does the tape job, you'll start from the medial aspect of the leg, anchor it there, come all the way underneath the heel, and keep that foot up, and then you're going to pull up really strong here, and then anchor it to that side. And what you'll do is you'll use your hands to smooth out the tape and to allow it to adhere to the leg. Okay, so that's the first stirrup here. Now, what we talked about yesterday is doing another, we can call it an ankle wrap there. Okay. And then the second stirrup, so there's going to be 3 stirrups. Keep that foot up, yeah, good. And another, so you have 3 stirrups, 3 leg, 3 wraps around the leg, horizontal wraps. The third one, what will happen is it comes underneath the foot, okay? Keep it up. And you can also push on the foot with your body, whoever's doing the tape job. And then so if we zoom in, you have the first stirrup here, or the first stirrup, I'm sorry, here, second stirrup there, third stirrup is almost directly underneath the arch, okay? Okay, and then the third horizontal wrap is higher. Then, usually what I do is, instead of just doing 3 stirrups and 3 wraps, I'll lock the stirrups in. So you overlap the horizontal wraps about half and half. Okay. I'll do one more. And then you have your anchor set for the rest of the tape job. So the next part of it is a heel lock. So the heel lock is going to start across the front of the, more at a diagonal angle, and it's going to go underneath the heel, and it's going to go behind the foot and up. Okay? And again, keep that foot up start, so we'll do it again. Across, underneath, and that you can really ride that up so it's really tight. It keeps that foot up this way rather than driving it back the other way. Just going to help protect that lateral inversion sprain. Okay. So usually you can do 2 to 3. You can actually do the opposite direction as well to kind of tie it in, just to keep that ankle really strong and the tape job strong and supported. So you can go either way. Make sense? Okay. So that's the heel lock. And the figure 8 starts the same thing. Figure 8, you start exactly the same way, but instead of going behind the ankle, you come in front of the leg. Okay. And then what you'll do is you'll come across and around and finish it off there. Okay. So again, cross underneath the foot, in front of the shin or the lower leg, behind, and this is where it starts right here. This piece of tape right there, that's where it started, right? And you'll finish it off like that. Now for a lateral, for an inversion sprain, you're always going to want to try to come from this side to the medial and up the lateral, right? And across. That's not to say you couldn't do the other direction, but you're not really going to emphasize pulling it that way. You're just going to utilize the figure 8 in order to just kind of make the tape job a little stronger. Okay, so that's that. Heel locks, ankle locks. Heel locks behind, ankle locks in front. And then what you'll do is you'll just finish it off. And so you'll go underneath. So we'll start a little bit further. Not in this orientation, but just a little bit. Just allow it to kind of not be so horizontal, and it'll keep it a little bit more, it just keeps it a little stronger, I think. And just makes it look a little bit better too. You always want to finish the tape job off on top of these are the stirrups here, on top of the stirrups, okay? Now, this is a very high ankle tape job. I usually go pretty high. I usually don't go this low because I don't really feel that it's as effective. So I usually go up to about, I don't know, 2-3 inches above the malleoli, lateral and medial malleoli. Okay, so it's pretty high, so it almost looks like you're wearing a sock. If it's low, I don't think it's as effective, okay? That's that, and then you'll finish this one off. Just like that. Okay? Tie it in. You're good. So